Hi everyone, welcome to today's episode of Licensure Hub. If today happens to be the first time you are joining us, I will urge you to subscribe to our Licensure Hub channel so that as and when we release any new video, you will be notified to follow us accordingly. Our first question for today reads, laboratory investigations were requested for Mr. John. The results indicated protozoa and bacteria. As causative agents for his condition, the doctor on duty assessed the result and described it as concomitant infections. This means the presence of A. Two or more parasites in one host, B. Several parasites in one host, and C. Parasites of different species in one host. When we talk about concomitant infections, it simply means the presence of two or more parasites in one host. That is what a concomitant infection means. So back to our question on the screen. They made mention of certain parasites found in the patient's body or lab investigations, which were protozoa and bacteria. So per the explanation earlier on concomitant infection, we realize that our first option, which is two or more parasites present in one host, will be the most appropriate answer. That best defines a concomitant infection. Our next question, which reads, a 50-year-old patient on your ward with deep vein thrombosis is on heparin therapy. Which of the following is used to reverse the effects of heparin? A. Vitamin K, B. Protamine, C. Penicillamine. Deep vein thrombosis have been mentioned. What condition is that? This is a condition that occurs when, due to prolonged immobility in bed, that causes blood clot to form in your deep veins of your lower leg, specifically the saphenous vein. When this happens, it is important that medically you treat it by giving various anticoagulant medications to help dissolve any clot. And the best treatment for that is by the use of heparin. Heparin and warfarin belong to a class of medication called anticoagulants. They act against coagulation. They help to dissolve clots. Now, when you use heparin and there has been an overdose, the reversal agent that you use is protamine sulfate. So protamine sulfate is the reversal agent for heparin overdose. Vitamin K, which is in the option A, realize that in one of our previous episodes, we saw that vitamin K was a reversal agent for warfarin overdose. And so in this question, the overdose here was subjected to heparin. Therefore, our correct answer will be the protamine. So protamine is the reversal agent for heparin overdose, making option B our correct answer. Our next question, which reads, the nurse should expect a patient with bradycardia to have a heartbeat that has regular skipped beats, B, heart rate of under 60 per minute, and C, heart rate over 90 per minute. One may ask, what then is bradycardia? Brady is a prefix that has to do with low level of something. And when we talk about cardia, it has to do with the heart. So bradycardia simply means that the heart rate is lower than expected. What is the normal heart rate of a human being? It ranges from 60 to 100 beats per minute. So any reading lower than 60 is termed as bradycardia. And any reading above 100 is termed as tachycardia. So once bradycardia means low heart rate, tachycardia will simply mean what? High heart rate. And so back to this question. The question on the screen is saying that the patient's heart rate is low than normal, or the patient is having bradycardia, this should quickly tell us that the heart rate is under 60 beats per minute, meaning that when I count the patient's heart rate, I will not get up to 60. And that is what defines bradycardia, making option B the correct answer in this question. Assuming the question has been twisted again, where tachycardia has been placed over there, you realize that our option C will now be the correct answer. But here they made mention of bradycardia, making that option the correct answer, option B being the correct answer. Our next question. A disease with an unknown cause is usually described as dash disease. A. Idiopathic, B. Communicable, and C. Iatrogenic. In the medical setting, diseases are basically classified on how they are gotten. When we talk about iatrogenic causes of disease or iatrogenic disease, these are diseases that the patient got due to medical practice. So when the doctor or the nurse attend the patient, as a result of the procedure, the patient ends up getting a disease, we classify those diseases as iatrogenic. Communicable diseases, option B, what are those diseases? These are diseases that can be transferred from one person to another. Example, cholera, COVID-19, which just hit the whole world. These are examples of communicable diseases, like chickenpox. So these diseases, when I contract a disease and someone is close to me, when the person does not observe precautionary measures or barrier measures, he or she can't get those illnesses. And it is those illnesses that we use in the nursing setting to apply our barrier nursing so that we will not contact those illnesses. These are communicable diseases that can be transferred from one organism to another. Then idiopathic. Idiopathy in the medical setting means a cause of disease is unknown. That is idiopathy. A cause of a disease is unknown. And so when we say a cause of disease is unknown, the medical term that we use for that is idiopathic. And so back with the question on our screen again, they were asking that a disease with an unknown cause will be described as what? We have no option than to choose idiopathic as our correct answer. Our next question, which reads, as a general rule, after abdominal surgery, normal bowel sounds should be present before A. Ambulation is begun, B. Dressing is changed, and C. IV fluids are discontinued. We all know very well that before surgery, we do fluid therapy, which can be the maintenance therapy or the supportive therapy. The maintenance therapy has to do with giving IV fluid to the patient to maintain the electrolyte balance as well as the nutritional balance of the patient, because the patient is going to be on nil per os, and you cannot deprive the brain cells of glucose. And so we are going to give the patient IV fluids during and even after the surgery. Now, as a general rule of surgery, you will discontinue IV fluids when your bowel sounds return, because you cannot feed the patient if bowel sound has not returned. And so when the bowel sounds return, then you cannot discontinue the IV fluids gradually and begin the patient to feed on clear liquid diet. One may ask, how will I know, or how will the nurse know that bowel sound has returned? The criteria for knowing that bowel sound has returned include: 1. The patient passing gas, which is mostly termed flatulence. Or the nurse can also use the stethoscope to listen to the normal bowel sound. These are some of the criteria that can tell you, the nurse, that a patient bowel sound has returned. And so back to our question on the screen, our correct answer will be what? So IV fluids are discontinued. This comes to the end of another interesting episode of Licensure Hub. I'll urge all of you to continue to subscribe to the channel, that is those who are new and haven't subscribed, kindly hit on the subscription button, like and share so that we can have more interesting and educative videos being notified to your notification button as and when we release a new videos. Thank you and see you on our next episode.